Hello and welcome to another episode of Clean Talk. I'm your host, Brad Whitchurch. We are coming to you live from the Seal Shield Studios in beautiful, sunny downtown Orlando, Florida. Very excited for today's show. We're going to be talking about whole room disinfection systems. And my guest today, Maryalice StClair, is the Chief Commercial Officer with Halosil. And Halosil has an innovative whole room disinfection system that's being used in healthcare today. Maryalice, welcome to the show.
Thank you so much. I'm very happy to be here.
Well, we're glad to have you. And I know that our audience is going to be extremely interested to learn about the solution we're going to be talking about today. That's the Halosil Dry Fog Whole Room Disinfection System. But before we get into that, Maryalice, I know you've been consulting with healthcare systems for the better part of a decade over best practices for whole room disinfection. What can you tell us about your background and how you got involved in this business?
So I got involved with this business as most a second career, having come from a medical family, pharmacy and medicine, and always had an interest in that. And when some friends of mine founded this company, I started working with them, doing some marketing and sales work. The technology was very, very new. 10 years ago, no one knew what whole room disinfection was. People had been using spray and wipe since the Civil War. There really had not been any kind of innovation in the concept of disinfection prior to that. So our technology actually received the EPA's first registration for whole room disinfection. We pioneered this field. We worked with ATS Labs, third-party GLP-registered lab, and EPA to develop the testing protocol for it to prove that we actually do disinfect the whole room and we achieve the efficacy that's needed to kill really nasty pathogens like c-diff.
Well, I'm really interested to hear about how you validate the claims and the efficacy of the device. And I'm very interested to hear about those EPA protocols and why that's important. But first, can you tell us a little bit about the company, Halosil's origins and how that came about?
Sure, I sure can. So our technology originally was discovered in Switzerland. And we had an affiliate at the time who was using the technology over in Europe. And our business founding partner, Chris Ungerman, brought the technology here. And we originally brought it over as, really thinking it would be a good consumer product, but really realized that the disinfection was very, very effective and that it was really more of a healthcare grade disinfectant. So we went through the registration process to get the registration. The very big difference is that our product is not a wet spray. Okay, there's a big difference between spraying and whole room fogging that's got an EPA registration. Very, very regulated and specific technology and use instructions. So we create a dry fog that evaporates very quickly into a vapor. You may be familiar with vaporized hydrogen peroxide, VHP. Yes. Okay, we have the same efficacy and kill. However, the technology is much less difficult to use. Our material is a 5% hydrogen peroxide solution as opposed to a 35% solution. So it's very easy to work with. 35% peroxide is a hazmat. It's difficult to work with, requires a lot of training. Our product is got excellent material compatibility. There's nothing in it that's going to corrode or harm surfaces. So between that formula and the dry mist application, there's no wetting of surfaces. The vapor fills the space, every nook and cranny, to disinfect every nook and cranny to the exact same sporicidal kill efficacy without damaging surfaces.
So I am very familiar with hydrogen peroxide vapor and how effective it is. And you explained a little bit, but can you clarify for me what makes it a dry fog? What is that? It's still vaporized hydrogen peroxide, or it's something different?
So we begin by aerosolizing the liquid in our Halo fogger. And the Halo fogger is very, very important to the process. It's not just any fogger. So as a matter of fact, the way we are regulated is as a system by the EPA. Although the regulated part of our system is the Halo Mist, and that is what has the EPA number, registration number. We must use Halo Mist in the Halo fogger according to our use instructions to make the kill claims, because that is how all the testing was done, with all the components of the system being, part of the outcome and part of the resulting kill of pathogens.
So there's a lot of other solutions on the market for whole room disinfection. Seal Shield has a healthcare advisory council. As you know, Randall Rensselaer from Artesian is on the Seal Shield Advisory Council. And that was the first time I heard about the solution. And I was immediately intrigued. We do a lot of work in the UV space for device disinfection. We've had a lot of guests on this podcast who talk about UV solutions for whole room disinfections, but they will all admit, and I'm well aware of a lot of the limitations that exist with UV as a whole room disinfection solution. You have shadowing, you have micro shadows. Tell us, how the Halosil solution and the dry fog compares against some of the other solutions on the market, not just vaporized hydrogen peroxide.
Sure. So really, we need to put the whole in whole room disinfection, as we say. And while UV is certainly a tool that we could have in our arsenal to sanitize and perhaps be, an effective disinfectant against some easier to kill types of pathogens, when we really want to kill a pathogen that needs to have a 6-log or 99.9999% kill on every surface to be effective, we need to look for something that is more complete. Because when we aerosolize our product, it then evaporates to a vapor, which fills the entire room, touching every nook and cranny, every surface. Nothing is left to chance, nothing is missed. So every time you fog that room, you are going to get the same repeatable, complete kill. Truly whole room. Okay, every surface in that room that is exposed to the vapor is disinfected to that sporicidal kill level. It's not there. There is no guesswork. There are no shadows. There are no distance from the walls, or the surfaces that are under things or behind things are not touched by the light. Maybe light bulbs that are not effective. Plus, one thing that I have heard that I find very really disturbing is that the amount of time it takes. Okay, we can put a UV light in a room for a certain amount of time, and perhaps we can achieve a certain log kill on certain surfaces. That does not mean that we've killed things on every surface. There really is no magic bullet here. If we're going to really try to kill a nasty pathogen, we have to allow for the time to do that if we want to get true whole room disinfection and truly not leave dangerous spores or fungus or pathogens behind to infect the next occupant of that room. It's very important, no magic bullet here. We need to take time to disinfect properly.
I agree. And you mentioned time, and we know that utilizing UV robots for room disinfection does take down time on those rooms, isolation time. But I know hydrogen peroxide, while it is highly effective against pathogens, it also can be harmful to people. What kind of isolation or dwell time is required for the solution?
So actually our product, we have use instructions which are fog inside, people outside, right? So we're not using any kind of a spray or like a fog where we're needing to wear proper PPE because we're standing there, trying to fog a room, so to speak. We're actually spraying that room and being in the room with the disinfectant, all right? Our system is touchless. We prepare the room by making sure that we close off any event that's going to suck the peroxide out, right? Any outtake. And we don't want a huge, steady, gush of fresh air coming in. A little bit isn't going to hurt anything. So we want to turn the air conditioning down during the treatment. That's going to let the fog dwell for the time it takes to reach all the surfaces, touch them effectively before it begins decomposing into, nothing. So that we can re-enter the room without wearing PPE and without having any kind of residues or wetting. Okay, so it's very safe because the operator is outside the space. The room is closed up. We placard the door. We leave the room alone. We let the product cook and kill. So it's very, 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 very safe for the operator. There's no exposure to harmful chemicals as long as we follow our use instructions, which are quite straightforward and simple.
And what is the typical disinfection time for a typical room? How long does the process take? And then how long does it take for the hydrogen peroxide to dissipate so that it can be used again?
Sure. So to kill spores, we need a 30-minute dwell after the fog time. Obviously, the larger the room, the more time it takes to fill that room. But then we need the time, which occurs simultaneous to the dwell, for the fog to aerate, dissipate, break down, whatever you want to call it. And that generally will take about 90 minutes plus twice the fogging time. So it will depend on the size of the room to enter the room without any kind of PPE or respirator or anything like that. And that is generally how most of our healthcare facilities operate, especially acute care facilities. They do need to get those rooms turned and reoccupied. Facilities such as long-term care facilities where, you're typically doing this process after a patient has left the facility and a new resident's coming in, or if we want to, that lots of times they just do that overnight. They just kind of close the room up and fog it and come back the next day and they're ready to go. So there's no wiping or rinsing after the process. It's a no wipe, no rinse formula.
Well, that was going to be my next question is if what was the interval that this is typically done at? Is it done between various patients or on a daily interval? And you're saying that often it's done on a daily interval or on a periodic interval. Is that right?
So typically our hospitals, acute care hospitals, if that's what we're talking about, for patient rooms, buy our system because they would like to have a very effective tool to fight C. difficile infections, healthcare acquired C. diff infections. And those, and in that case, typically when the room is terminally cleaned and disinfected, the fogging is the last step after the cleaning of the room. So it's used in isolation rooms. Our system is typically not used for every discharge because it does add time to the turnaround. That is really, it's not really needed for every discharge. But when we have an isolation discharge like C. diff, C. auris, any other pathogens that are, you really are going to create, the potential for a healthcare acquired infection, we want to make sure that we use this system as part of our terminal clean. The other place it's used, for example, is in the OR for a terminal clean. Maybe not every day at the end for the terminal clean, but periodically to make sure that every single nook and cranny in that OR is terminally cleaned. So you have to understand that once we remove the gross filth from things like walls and floors, the system will do it all, right? There's no need to try to clean and then disinfect every single surface in that OR space. The system is going to touch every surface and disinfect that surface to a 6-log kill.
Well, it's absolutely critical. We have stated on this show that superbugs are recently, hospital-acquired superbugs are recently on the rise again as a result of the overtaxing of the healthcare system because of COVID. You mentioned C. diff, and I've seen a study that suggests that you have an 80% higher chance of contracting C. diff in a hospital if the person in that bed before you had C. diff. Why? Yes. Because they're not adequately disinfecting those rooms, because there are not widespread solutions for whole room disinfection or protocols that require that. Right. So I think what you're doing is fantastic. It's very needed. I hope we see a lot more of it in the healthcare systems that we're servicing. Maryalice, we have a question from one of our viewers. Dr. Norman Horn asks, what is roughly the rate of aerosol volume production of your device? And are you limited by the size of the room at all?
Yes, we are limited by the size of the room per fogger, but we may also use multiple foggers. Now, typically in a hospital, our fogger is much more than adequate. Our fogger puts out 50 milliliters of disinfectant per minute. It aerosolizes that so that an average patient room will take 10 to 15 minutes to actually fog. Okay, one of our foggers can fog up to 10,500 cubic feet. So you can do quite a large space. If you have a larger space, you could run 2 simultaneously. But I rarely see that. Normally in a typical healthcare facility, unless you're doing a common area in an LTC or a reception area, one fogger does the job. So the generation of the fog is quite quick. Also, the fogger, and I'd also like to just talk about cost, because I know that's a big issue. And I think that when people, hear about UV systems, some of these fancy robots, and also vaporized systems, I mean, they can run, well from, like $60,000 to, $100,000 plus.
Or more.
Or more, right? Our system is meant to be affordable. So we have the most effective and most affordable whole room solution on the market today. And that is not just some trite phrase. It is actually correct. Cannot get more effective than a 6-log kill, against C. difficile spores. And, our fogger, the actual fogger retails for $9,975. Plus, if you need, room to if you want to cover your vents, if you can't turn those off, a basic starter system to do one room, is going to be, about under $12,000 to get started.
Well,
and
I
the
might have to
system,
get one for
yeah.
my home then. That's
Well,
almost in my price.
we don't sell to the consumer. Maybe I'll make an exception for you.
Well, I would appreciate that.
The system is very affordable, and they're very sturdy. There's no flushing or draining at the end of the night. You don't have to do that at all. The Halo Mist has a 2-year shelf life. There's no mixing or dilution. It's a one-part system. You just pour it into the fogger. It lives very happily in the fogger reservoir. For the, and you can just top it off. So you're not wasting disinfectant. You don't have to generate it on site. You don't have to be sure that it's, the shelf life hasn't expired. It's meant to be a simple and user-friendly solution.
Well, it's easy, it's affordable, and it's effective. Why don't I see it in more hospitals? What other markets are you focused on, and what are your strategies moving forward in this COVID pandemic world we live in now?
Sure. So, we are a small privately held company. We don't have, the deep pockets of Clorox. So, we started at ground zero. So, we have made tremendous inroads in the healthcare market. I would say our biggest objection to a sale is, it takes too long. And, what we say is, look, we're not advocating that you use this for every single discharge. We use this for terminal clean and disinfection of isolation rooms. Use this in your ORs for periodic terminal clean and disinfection. And then we see a lot of hospitals start using this to fog equipment. We have a lot of hospitals that have just made equipment rooms. They push in everything that's not nailed down: wheelchairs, gurneys, keyboards, all that kind of stuff. And they fog that. It's much easier to disinfect those complex surfaces with fog than trying to disinfect them by hand. And material compatibility is excellent. So you're not, corroding or damaging surfaces, computers, screens, electronics. We can fog everything. So we have made a lot of inroads with, sort of coming from a small business kind of background. And, we're continuously getting into more and more hospitals and long-term care. But we're also very active in the school market, education market. That's a very, very large business for us. And we have a very active life science business through our partner Quip Laboratories, who, has just been playing in that boutique niche for forever. They're in every veterinary research facility, veterans hospital research facility, biotech facilities. A lot of our regulatory agencies use them in their labs through that in that market. But also during COVID, we got our first transit company. We are fogging the cars on the Dallas DART system. We've also developed a new system called the Halo Fogger Pod, which runs without electricity. It runs on compressed air, which basically, every police and fire, firehouses have compressed air. They can, put the pod on the vehicle. It's great for ambulance disinfection, but it's also great for mass transit, where we can go down the row of cars or buses, boom, 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 turn it on, runs on the compressed air, pick it up and go on, instead of dragging something that requires power through a rail yard. So, a little bit of innovation brought on by, responding to the needs that COVID sort of unfortunately put on us. So.
Well, that's fantastic. I would love to see you on the airlines. I know some airlines are promoting the UV solutions that they're using. I think as those planes go out of service in the evening, what a perfect opportunity, right? Would love to see that come into play. I travel a lot, and, in this COVID world, you always kind of wonder what you're getting into. I guess you really don't have to wonder, right? You know what's on the plane. You're in a tin can up in the air. We have another question, Maryalice, from Dr. Norman Horn, another follow-up. He says, how does the dry fog aerosol not affect microelectronics in a disinfected room? Why doesn't it mess with instruments at all?
Because we do not wet the surfaces at all. There is no wetting. If there is wetting, something's wrong with your process. Either the humidity was too high, or you said, gee, this room needs a 10-minute fog, but more is better. I'm going to fog it for a half hour. You'll create condensation. So, more is not better. We don't wet. The whole technology is creating a vapor that concentrates the active ingredients into a vapor and just, touches those surfaces for a time that's long enough to be effective, but will not condensate and wet. So, we've been doing this over 10 years, and I can tell you that we fog all kinds of electronics. We actually are approved by Boeing, by the NTSB, I always forget what this is, and by Honeywell for use in the cockpit on their, electronics. So I think that's a pretty good testimonial to have. Where we've been doing this for a very, very long time, and that's the technology.
So non-corrosive, dry fog, no material degradation, safe for electronics. Sounds fantastic. Now, I do want to talk about how you're able to validate your success and what was required to get that EPA registration. Are we talking about just validation of surface disinfection, or is there an air component as well?
So our registration currently is for surface disinfection, which is pretty much any competitive technology is for hard non-porous surfaces.
Yes.
And that's what we have right now. So our process was that we had to test 3 different lots of our Halo Mist, 3 different age lots to prove we have the 2-year shelf life, and just randomly selected bottles out of lots. On a total of 576 carriers of the pathogens that are on our label, and we had to kill 100% of them in every test. And the room that was created was a room with very, very complex surfaces, and the coupons were placed all over that room. And every single one of them had to be killed, 100% of the time. So typically, that was our process that we went through. It was a 2-year process. Over 2-year process with EPA to get that first registration. And then, of course, we've been used in the field for 10 years now. Even, we were used as beta sites, testing sites prior to actually getting the registration. So over 10 years. I'm pleased to say that in April, we anticipate a publication of our peer-reviewed white paper, which describes the use of the Halo system for a 10-year period at Pennsylvania Hospital, which is part of Penn Medicine here in Philadelphia. So we're really happy about that. It took us a long time. As a small company, we can't fund studies and pay people to do studies. We had to find a hospital that really had great success and was willing to share the fact that they had a C. diff issue when they started, and that they corrected it, and they have kept it at bay for almost 10 years. So please keep your eye out for that.
I will definitely keep my eye out for that publication. Looking forward to that. Let me ask you this question, kind of maybe a curveball for you, but I'm thinking now as we're talking and you're talking about how it's validated for hard non-porous surface disinfection. Is there a risk that because you're creating an aerosol that airborne pathogens could be spread as a result of this technology, or do you have any data on that issue?
No. So I think that, when we talk about spreading by aerosolizing pathogens through, that process of the body and aerosol, that's a very different process and technology. We aerosolize the peroxide in the sealed room to kill everything. As a matter of fact, we actually have done our own testing, and this is very typical of how testing gets done in order to get a registration. You do it privately yourself with a reputable GLP lab, and then you go to EPA, and then you develop a protocol. So once again, we are pioneering proving that we also kill any pathogens that are floating in the air. We've had excellent results on our own private tests that we've done through, the GLP third-party lab, showing that we achieved the same kill in the air as we do on surfaces. But we certainly cannot claim that legally because we don't have that registration, and we are very careful to not make up stuff that hasn't been say stuff that hasn't been approved by EPA. So, stay tuned. This will take time. It's a very slow bureaucratic process. And I'm sure it's going to be an expensive one, but we have sort of already met with EPA and said, we want to get on the docket for this. And, unfortunately, it's not going to be tomorrow, and it's frustrating, but they're aware that we have these results and want to make way for a claim.
Well, can you talk a little bit about the experience of the process with the EPA? We deal with a lot of technology innovation manufacturers, and it's always an issue of what do you need to do with the EPA? What should you do with the EPA? Is the process too expensive, too onerous? How much time does it take? What can you share with our viewers about that?
So I certainly am not, wanting to, present myself as an EPA regulatory expert. I'm not. I know what our company's experience was. It was different because there was no protocol, there was no product, there was no technology like this. So it was a longer, the whole thing, the whole process and protocol for testing had to be developed. It wasn't like, here are the requirements. Here are tests that we've gotten from a lab to show we meet the requirements. We had to, they had to be created. So it really does range, in the gamut. But the EPA is a very strict regulator. I don't care what you think of regulation or the EPA. We are fortunate that we have regulation in this country so that people and the consumer and the patient are protected. And so we are very, very fortunate. We don't have all kinds of like foreign companies coming in here making false claims. We don't have, we have companies that do make false claims from time to time. And if they are under the purview of the EPA, they are, eventually they're found out and a stop is put to that. So, it's a necessary part of our healthcare system is to have somebody watching over us. And there are devices that are being marketed now that don't have any regulatory oversight, which, let's face it, a UV is not regulated by anybody. So,
it's getting there. It's getting there.
You can say what you want. We can't. So.
Actually, the EPA and the FDA are kind of drawing the boundary lines around UV specifically. But you mentioned you were the first to get an EPA registration for this system.
That is correct.
Are there other systems now? Did you pave the way for other solutions, or are you still the only solution that has this registration?
There are a couple other ones out there that have subsequently then, met the requirements and passed the testing and do have EPA registrations for whole room fogging with dry mist with a 6-log kill. They are more expensive to acquire than our system, and significantly so in my, quite frankly. But yeah, there are a few other ones, but not many. So, what we see a lot of is people saying fogging is fogging when it's really spraying, because surfaces have to be wetted. And if they're not wetted, then there's no efficacy. So, you're really wasting your money, and you're also, it's not effective, right? Surfaces have to be wetted if they're not fogged according to the specific technological method.
Wetted with appropriate dwell time, right?
Exactly.
And that can be a challenge as well.
That is correct. So there's a lot of, and I do think during COVID, even I have to say people at CDC do not understand that EPA registered fogging is not just going to Home Depot and buying some, ULV cold fogger and throwing some kind of disinfectant in it, walking to a room and, setting it off like it's a bug bomb. That is not effective. That could be dangerous for people who are not wearing the proper PPE or, so that is what CDC is really advising against, not against EPA registered whole room fogging that's approved and, to be safe and effective.
So we talked a little bit about the difference between dry fogging and the vaporized hydrogen peroxide, the potential benefits of whole room disinfection over some of the UV solutions. What about electrostatics? Where does that compare?
So electrostatic is a spray technology. And if you spray the disinfectant with the electrostatic gun and spray every surface, which as a human being, you're not going to do. It's not magical, right? It's not like, the disinfectant will stick to a surface better with a UV charge, but it is not whole room disinfection in any way, shape, or form. It is a manual spray. Even if you have a system that sits and goes off by itself, it is still a wet spray. You must wet the surface. The surface must be touched, wetted, and maintained, the wet contact time maintained for the required amount of time for that surface to be disinfected. I would challenge anybody to, in a reasonable amount of time, find a person who's going to stand in a room and wet down every single exposed surface in a room for, 3 to 10 minutes or whatever it is, and get the same efficacy that we get from fogging. It is basically, it's just not going to happen. So it's very different. Does it have a place in the disinfection portfolio? Sure, it does. If you want to go spray down some, vinyl chairs in your waiting room, things that aren't, if they get wet, they're not going to be damaged. If you want to come and wipe away residue, which often comes with that type of a product, it's great. Fogging is not for every space. Okay. We're pretty clear about that. You can't go into a convention center and put your fogger in the corner and say, oh my gosh, I fogged, Madison Square Garden. It's just not going to happen, right? It's for, we need to fog in a finite, isolated space. And, it's a tool for a specific use.
Well, it's a tool for an important use. And let me ask you this, in the COVID world over the last couple of years since 2020, spring 2020, how has that affected your business? Are you seeing people and institutions more interested in this technology, more opportunities? Have you seen a rise in demand? What has been the impact of COVID on your business?
Sure. So, we saw a huge increase in the beginning because nobody knew what this was, how to kill it, what to do with it. And, we basically had to turn away people who were just calling and saying, I want this. It was like, no, we have to, provide to, first of all, we don't sell to consumers. We're not selling to everybody who wants to start a disinfection company because they deliver water bottles in an office building. No. Okay. You need to, this is a professional commercial grade tool. But we did see a lot of demand. And, I think where we see a lot of demand is in, public buildings. Saw a lot of demand from, government buildings, educational facilities, especially first responders who are, had people in their vehicles that could have been infected. We do a lot of, so that kind of thing. We did see an increase in, and, transport, that kind of, those kind of things. But, our core business really, it has a lot to do with healthcare. That is a very core business for us, healthcare, science, labs, that kind of thing. But the product, we're able to be used in many, many different, use areas, and we still see demand. It's higher than it was pre-COVID for sure, but it's not like it was in the beginning of 2020.
Well, we have a number of infection preventionists who watch our show. And for those individuals who are interested in finding out more about this technology or in evaluating this solution, what should they do, Maryalice?
They can contact us at info@halosil.com. You can Google us, Halo Disinfection System. They can call me directly if you can provide provide my contact information.
We can tag that.
Certainly happy to do that. We have a website, www.halosil.com, that I believe is quite informative. You can see the fogger models that we have. You can look at, we have case studies that are available. But just feel free to contact us. We're happy to chat with you and see if the whole room disinfection system is part of what you want to have in your facility as part of your portfolio, to have a tool for, those isolation rooms, c-diff, CRs, especially your terminal disinfection of an OR, equipment disinfection, emergency vehicle disinfection. This is a tool for you, and it can be acquired at a very, very, cost-effective level. We mean to have it. We want every hospital to have this, from a rural clinic to, Pennsylvania Hospital, Boston Medical Center. We have large and small hospitals, all over the country, and as a matter of fact, all over the world. So, please feel free to give us a call, and we'll be happy to provide you with a quote and talk to you more about the system. We also have a lease to purchase program. So if you're looking, if that's something that makes sense for you, but we're here to help you and to provide a tool in your arsenal.
Well, thank you so much, Maryalice. I've been in this business for a while. I get to see a lot of innovative technologies. And quite honestly, I think this is one of the best solutions I've seen in a long time. I don't know why any facility wouldn't want to be implementing this, at least as part of their infection control protocol. So I really appreciate you coming on the show today to explain the technology. It's cost effective, it's effective, with great efficacy, EPA approved. You can reach out to Halosil and talk to Maryalice if you want to learn more. Thank you for being on Clean Talk today, Maryalice. Be sure to join join us next week on Clean Talk when our guest will be Randall Rensselaer of Artesian Health. Randall is the first person who told me about the Halosil solution. So I'm sure we'll talk a little bit more about that next week, as well as some of the other best practices that Randall is using over at Artesian. Join us next week, 3 p.m. Eastern time for that discussion. Until then, for my guest, Maryalice StClair, I'm Brad Whitchurch, reminding you to keep it clean.